The medical field is a very challenging and hard industry. The need for this field is growing on a daily basis. There are several different fields and levels of medical jobs. Every second, someone around the world seeks medical attention while seeking out a medical profession. People look for education needed, the demand of the job, and the pay rate at that time. The levels of education for an individual job is in the medical field as stated by collegegrad.com. The registered nurse. The registered nurse needs 2 to 4 years for her college degree, or his. An associate degree that gives an individual the registered nurse. And a bachelor's degree will give that individual a bachelor's of science in nursing. The other requirement is the state licensing, which must be taken in each state. The person using this degree to seek employment. Licensed practical nurses must complete 1 year of an accredited nursing program. They are supervised by an RN or physician. They also have a licensing exam that needs to be taken. The nurse's aide requires a variety of training programs by skilled trained instructors that are usually located in technical schools and hospitals. They can take an exam that certifies their field. So I have the top degree charts by hourly rate. Of course, this increases as your education gets higher. So the medical assistant starting out makes $10.76 to $14.21, and each pay rate goes by the years of experience and the different states that you're in. Medical assistant certified actually makes less than a particular medical assistant, and I think they must have made an error on this. An associate of applied science makes about 7 cents more than a person who just has a medical assistant degree. An associate of science AS makes $1 more an hour, and a certificate of completion for this program makes $10.50. This is according to www.payscale.com and then /research. Being able to directly relate to the education perspective, I am currently seeking a bachelor's degree of nursing. I started out looking in the local college at University of Texas at El Paso. The program requirements were extremely hard to accomplish, and with the acceptance of students from Mexico being able to take the slots from the program and knowing that they will accept a pay decrease. And this goes to the key statistics for the program. And it just says that here, the years of experience, less than 1 year, you get 8% decrease in the pay scale. And then 1 to 4 years, you even increase 49%. And 5 to 9 years is 22%. And that's also by the payscale.com. So, and the pay decreases. For students who are U.S. citizens, they require entry-level pay in the field. I have finally found a program that I can continue to work in, my current field, and train and take classes to make a higher pay rate. Because while living here in El Paso, there is no way minimum wage for any medical career is acceptable. And then, of course, for education purposes, the Human Anatomy and Physiology book is the same for an associate's degree of nursing or an RN for the RN and the certified medical assistant. They use the same textbook. There are several medical fields that are in demand around the United States. Home health aides are number 1. This is the lowest paying job in the field. Medical assistants come in second. Registered nurses are in third, and physicians and surgeons are in fourth. The home health aides are projected to have the highest rate of growth of 50% by 2018, as stated by About.com Health Careers. Medical assistants have a projected growth of 33.9% from 2008 to 2018. Most medical assistants are trained on the job. Registered nurses have a projected increase of 22.2%. Over 500,000 more registered nurse jobs are to be added in the 10-year period from 2008 to 2018. Physicians and surgeons have an expected growth of 21.8% by 2018. Looking at the demands of jobs and the order of need, you can see that pay is the #1 reason why the list is in that order. I am a certified medical assistant in the state of Texas. I have been in the profession for over a year. I am able to administer medication. Unlike the nursing assistants, the job is usually in the physician's offices. And then back to experience, when you're a certified medical assistant, your pay is actually less than the nursing assistants. Nursing assistants require less training than medical assistants and make more money. Nursing assistants work in hospital settings with great benefits, while medical assistants may have no benefits at all. This is why you need to know that the pay rate needs to be leveled out by the job done, not by the state you reside in. The rate of pay changes by the location. The cost of living causes the pay to change. But I am here today to enlighten you on the need for pay reevaluation. The job of the medical professional doesn't change from state to state. The risks continue to be the same, and education and requirements are the same. Why should someone living in El Paso, Texas, receiving the same degree make $10,000 to $20,000 less than someone living in San Diego, California? According to the Bureau of Labor Statistics, the local government employs over 64,000 medical professionals. Around the world, the average pay for a paramedic is $36,780, while hospitals make $33,390, which is approximately $3,000 less, and working for a private physician, you are making on average $32,930, $1,000 less than in a hospital. The salary drops or is increased from state to state. This is why the medical field needs reevaluation when it comes to pay rates and scales, according to BLS.gov website. Training and other qualifications have a huge influence on pay rates, but it still goes back to the economy and where you live. The medical professional has the same degree in Texas as they do in New York City. This needs to be reevaluated, and you need to consider the level of care being given by the healthcare professionals around the world. Salary tables need to be increased in the lower paying states to meet the other scales around the higher paying states. While trying to persuade all of you medical directors all over the world, I have proven that education is required in every state. The levels of education don't change. The different health professionals are in demand based on the rate of pay. The more demanding jobs are the least paying jobs, which the pay rate has lower ending jobs, change from state to state. Unlike the less demand jobs such as physicians and surgeons. The standard pay scale for positions in different medical care settings changed drastically, from one government position to hospital settings, and also in the physician's offices. The rate of pay in El Paso doesn't increase because people from Mexico will be trained in the U.S. and accept less pay. So the need for increased pay here is not a priority. As I stated before, there needs to be change in the pay rates of medical professionals because the quality of care continues to increase.